The doctor had put in an order for my patient Linda Belcher for Coumadin 5 milligrams PO daily for her diagnosis of atrial fibrillation. He did sign the order, so my first medication check is done. Going to the Pyxis is where I do my second medication check, where I will get out Coumadin 5 milligrams PO dose. It is not expired, and now I go to my patient's room. Knock, knock, knock. Hello, my name's Raylan. I will be your nurse today. I'm here to give you your dose of Coumadin for your atrial fibrillation. Have you ever taken Coumadin before? You have? Okay, so just kind of a little reminder, the side effects are bleeding. So if you notice any bleeding in your urine or stool, please call us to let us know. Do you have any allergies that we know of? No allergies? Okay, and can you just verify your name and date of birth? Linda Belcher, 9472. Awesome. Okay, let's scan the medication. And do you have any problems swallowing? No? Can you just take one sip of water before we administer the dose? Okay, went down just fine. And we did check your PT and INR levels, which you've been going outpatient doing also, and they are at therapeutic level, so we're going to continue your dosing, okay? All right, here it is. Awesome. Let me just put it into the computer that you got it administered. Awesome. Okay, well, other than that, you know to not eat foods high in vitamin K, since it is the antidote for that, and you do know that this medication is just a very high-risk medication and can cause some really serious effects, okay? All right, do you have any questions for me that I can answer? No? Okay, awesome. Well, hit your call button. It's right here if you need me, and I will come in to help. Thank you. The doctor has ordered Lanoxin 0.25 milligrams PO daily for my patient Stanza Stark for her diagnosis of heart failure. We will hold the medication if her heart rate is under 60. The order is signed by the doctor. My first medication check's done. Going to my second into the Pyxis. I will pull out my oral dose of digoxin 0.25 milligrams. It is not expired. Now we'll go see my patient. Knock, knock, knock. Hello, my name is Raylan. I will be your nurse today. I'm here to give you your medication, digoxin. It helps make your heart pump better. And we did check your digoxin levels prior since you were on it. And they are good, and you know that's at narrow therapeutic level, and you already experienced the symptoms of toxicity with the blurred vision. So we will continue to make sure we're on a good level. Are you still having that blurred vision? No? Okay, good. I'm just going to check your heart rate for 1 minute to make sure we are able to give this dose. Okay, perfect. It is at a good 73 beats per minute. Awesome. All right, just to let you know these side effects. As you know, the hypotension, lightheadedness, and dizziness. So if you're feeling any of that, if you need to go to the bathroom, make sure that you give us a call so you don't fall and hurt yourself, okay? And just for my third medication check, can you give us your name and date of birth? Stanza Stark, 2/21/90. And do you have any medication allergies? Just the penicillin? Okay, what happens there? Oh, yeah, a rash? Okay, no problem. And do you have any problems swallowing? Scan my medication. No, do you mind just taking one sip before me? Okay, it went down just fine. All right, here is your medicine. Awesome. And let me just document it in the computer. Okay, and since you will be discharged on this medicine, you'll have to be able to take your heart rate at home, and the doctor will give you parameters as to when you need to go seek for emergency help, okay? All right, just make sure you're taking it as instructed and at the same time each day, and then we'll be making sure to be checking your electrolyte levels, since they can cause some imbalance from this medication, okay? All right, well, here is your call light, and is there anything else I can get you? No? Okay. Have a good day. Call me if you need anything. The doctor has ordered hydrochlorothiazide 12.5 milligrams PO daily for my patient James Smollett for his diagnosis of hypertension. The doctor signed the order, so this first medication check is done. Going to the second, to the Pyxis. I will pull out hydrochlorothiazide, 12.5 milligrams, oral dose, not expired. And now I will go see my patient. Knock, knock, knock. Hello, my name is Raylyn. I will be your nurse today. I'm here to give you your dose of hydrochlorothiazide for your elevated blood pressure. Before I administer it, I'm just going to take one blood pressure before you get your medication. All right. And have you taken this medication before? No? Okay, so just some side effects for it. It does increase urination, which can cause some electrolytes imbalance, so we'll be checking your labs, making sure you're not super deficient in all of them. And with your help, you can eat foods high in potassium. Also, when you're discharged, making sure you're doing that also. This medication also causes lightheadedness and dizziness, so if you need to get up to go to the bathroom and you're feeling faint, just give us a call and we'll come and help you and try to change positions slowly, okay? All right, and do you have any drug allergies? No, you don't? Okay, awesome. And then for me, can you just verify your name and date of birth? Jane Smollett, 8/10/1985, awesome. Okay, and do you have any problems swallowing? No? Okay, but can you just take one drink of water before we get started? Awesome. Scan the medication. Open it into there. Here you go. Awesome, let me just document this. All right, perfect. And just when you're discharged with this medication, make sure you're taking it as directed, same time each day. This medication also does cause sensitivity to light, so make sure you're wearing your sunscreen. And to help also with your part in helping lower your blood pressure is be on a low sodium diet. Make sure you're exercising, managing stress, and this will help you lower your blood pressure as long as with the medications at home, okay? And do you have a blood pressure cuff at home that you use? No? Okay. So you'll probably want to get one to make sure you know what your blood pressure range is and make sure you don't go into a hypertensive emergency, and you can seek medical attention if you need to, okay? And we'll make sure to give you the parameters of what's good and bad. All right? Okay, is there anything else I can give you? No? Okay. Here is your call light. And let me know if you need anything, okay? The doctor has ordered 1 NitroTab sublingual now and a half an inch nitro paste also to be given now to my patient Taylor Swift for their diagnosis of an angina. My doctor signed the order, so my first medication check is done. Going to the Pyxis, I will pull out the tablets and the paste. Both are not expired. And now I will go see my patient. Knock, knock, knock. Hello, my name is Raylyn. I will be your nurse today. I know this is a scary time right now, but we are here to help you, okay? We are going to be giving you nitroglycerin tab and also put a paste on your chest so that this will help increase the arterial blood flow to limit blockages. We already got an EKG done, but we'll be continuously doing them. We'll give you a nitro tab once every 5 minutes if your pain is still there, okay? What do you rate your pain right now? Out of 6? Okay, I'm just gonna get a blood pressure before we start. Do you have any allergies to medications? No? Okay, and then can you just verify your name, date of birth for me? Taylor Swift, 7/21/1980, awesome. Let me just sanitize my hand, scan in my medication. So we'll do the tablet first. You will need to put it under your tongue and let it dissolve all the way, okay? I know there's a lot of people in here and you have a lot of things connected to you, but it's just so we can see everything that's happening, okay? All right. Do you have any problems swallowing? No? Okay. Well, you're just going to let this dissolve anyways. All right. So go ahead and put that under your tongue and let it sit there. I'm going to get the paste ready. I will initial, time, and date this. On the back, I will then administer half an inch. And I'm just going to paste it onto your chest. We're going to keep this on for about the next 12 hours. Okay? All right. Are you nervous? Yeah, okay. I know it's a lot going on right now, but we're just here to help you. Let me just document I gave you these medications, and we'll wait the couple more minutes to see how your pain is doing, okay? Okay, it's been 5 minutes. What's your pain level at now? It's at a 0? Okay, that's awesome. All right, well, we're going to keep monitoring you continuously, making sure if that chest pain reoccurs, just give us a call, okay? Here is your call light, and let me know if there's anything else I can do for you, okay? The doctor has ordered Lipitor 10 milligrams PO daily for my patient Dixie McCow for a diagnosis of hyperlipidemia. My order is signed. My first medication check is done. Going to my Pyxis for my second. I'll pull out an oral dose of Lipitor 10 milligrams that is not expired. I will go give this to my patient. Knock, knock, knock. Hello, my name is Raylyn. I will be your nurse today. I'm here to give you your dose of Lipitor since you showed elevated cholesterol levels. Have you ever taken this medication before? No? Okay, it just synthesizes your cholesterol. Some side effects can be like abdominal cramps, constipation, diarrhea, and gas. Do you have any drug allergies? No? Okay, and do you mind just verifying your name and date of birth with me? Dixie McCow, 3/6/1968. Awesome. Scanning my medication. Opening up. Do you have any problem swallowing? No? Do you mind just taking one sip for me? I go down okay? All right. Here's your medicine. Perfect. Let me just chart it in there. Okay, so you will be discharged on this medication, just making sure you're taking it as directed. One kind of interaction would be grapefruit and grapefruit juice. It does increase the risk of toxicity, so stay away from that. And then also just to make some lifestyle changes, you just need a diet low in fat, cholesterol, and carbs, and pair that with some exercise, okay? All right, is there anything else that I can get you? No? Okay, documenting my medication is in. Okay. Well, here's your call light. Please let me know if there's anything else I can get you. Thank you. The doctor has ordered Lasix 20 milligrams PO daily for my patient Amy Farrell-Fowler for her diagnosis of fluid retention. The doctor signed the order. My first medication check is done. Going to my second. I will pull out the oral dose of Lasix 20 milligrams. It's not expired. And I will go see my patient. Knock, knock, knock. Hello, my name is Raylyn. I will be your nurse today. I'm here to give you your dose of Lasix. You're having some fluid retention in your legs? Okay, has this happened to you before? It has? Okay, you take Lasix at home? Okay, perfect. Just to remind you of some side effects. It causes some stomach upset, dehydration, hypotension, and some electrolyte deficiencies. So for all that, we will make sure that you stay hydrated since you are increasing urination, and we will be checking your labs for your electrolytes, making sure they maintain good levels. And also, if you're feeling dizzy when you're getting up, just make sure you're changing position slowly, or call us for help if you need to, okay? We don't want you to fall and get hurt. All right, do you have any drug allergies to penicillin? Okay, what happens there? A rash? Okay. And just verify your name and date of birth with me. Amy Farrell-Fowler, 10/22/96. Awesome. Do you have any problems swallowing medication? No? Okay, do you mind just taking a drink of water for me? That went down okay. Awesome, I scan my medication. And open it up. Okay, here you go. That go down okay? Just document it in my computer. All right, perfect. We'll just make sure, like you did before, if you're gaining more than 3 pounds in a day, to contact your doctor and seek some medical attention, okay? Keep taking that medication as directed. Make sure you're staying hydrated since you are urinating a bit more. And let us know if there's anything else we can get for you, okay? All right, well, here is your call light. And let me know if you need anything.